Legislation before us today will detect, diagnose, and treat chronic diseases and health conditions at earlier stages, improve the quality of life for individuals with disabilities and their families, help ensure Americans in rural communities have access to life-saving care, and provide additional resources to assist in the development of cutting-edge innovation. Last month, we heard from numerous public health experts about how these programs are functioning and whether there are any gaps that need to be addressed in these programs to improve research and health outcomes for patients across the country. The bills before us today will help ensure these critical programs continue. To better help detect, diagnose, and treat Alzheimer's disease, I'm proud we are marking up my bipartisan bill, H.R. 7218, the Building Our Largest Dementia Infrastructure for Alzheimer's Reauthorization Act of 2024, or BOLD Act. The BOLD reauthorization also includes educational resources to help ease these challenges of those caring for loved ones with this vicious disease. These continued investments for caregivers are even more important now that we have treatments to slow the progression of Alzheimer's and will help to ensure patients and their families have more meaningful time together. I would like to thank Representative Tonko for leading this legislation with me, and I urge my colleagues to vote yes on the legislation. We're also considering the DeAndre Dixon Include project led by Chair Rodgers, which will allow current programs at the National Institutes of Health to continue cutting-edge research on Down syndrome. The Include project will continue to facilitate improved coordination across NIH and build upon research that will improve the quality of life for those individuals living with Down syndrome and can lead to medical knowledge that benefits all patients. To support patients and caregivers, we're marking up legislation led by Representative Kamek, the Charlotte Wood Organ Transplant Discrimination Prevention Act. The legislation would prohibit healthcare providers and other entities from denying or restricting an individual's access to organ transplant solely on basis of an individual's disability. Over a decade ago, Charlotte Woodward received a heart transplant and has committed her life's work to breaking down unnecessary and discriminatory barriers for individuals with disabilities in need of an organ transplant. Thanks to Charlotte's fierce advocacy, we're one step closer to ensuring individuals and their families don't have to go through what too many have faced when seeking life-saving treatment. Other bills being considered today are designed to improve access to critical emergency services for children and for those living in rural communities. The Siren Reauthorization Act by David Joyce will continue providing resources for rural emergency health providers, medical providers, to ensure they can maintain their essential services. I know we are still working through some policy considerations, but I'm confident we can come to a resolution before the program expires in September. Next is the Bipartisan Emergency Medical Services for Children Reauthorization Act. It is often said that children are not just little adults. This bill will continue programming designed to ensure EMS providers have the proper training and equipment to care for children in emergency situations. Finally, we're marking up two pieces of legislation that we heard about in the fall. The Seniors Access to Critical Medications Act, led by Representative Harshberger, and Kidney Patient Act, led by Mr. Carter. The Seniors Access to Critical Medications Act would allow cancer patients to continue receiving the necessary care in the safest, most convenient way possible. I look forward to working with my committee colleagues to advance these two bills out of subcommittee today and addressing any additional outstanding issues before full committee. Thank you to all my colleagues who worked hard to get the legislation before us today and for their leadership on these policies. I yield back and I represent the